How do these innovations reshape our understanding of ocular surface diseases? And what breakthroughs might be just around the corner? Let's explore these questions with our two guests. My first guest today is Alan Delbeck from UZ11. He is also a member from EuCornea Young Academics, and we'll talk about hemoderivates, treatments, and also about microbiome. Regarding the microbiome, we'll start about that.
Okay.
My first question is, what is the importance of microbiome and what relevance has the research about that?
So thank you for the question. The microbiome in general, it's extremely important. We know from the gut and the skin that it's important to keep us healthy. The healthy microbiomes can protect us from the diseased ones, the pathogenic ones. And probably the same is true for the ocular surface microbiome. At this stage, it's still an early on research domain. But we know, for instance, that it has an importance in dry eye disease. We know that patients with dry eye disease have a different microbial composition compared to healthy and non-dry eye disease patients. So it has a clinical relevance indeed.
Mm-hmm. And regarding the clinic aspect, how do you think that the knowledge of the microbiome will impact our clinical practice?
So I think the first thing that will come into the market, it's some kind of a risk assessment tool, because with a good scientific background, I think a risk assessment tool is the easiest thing to develop. I hope we will be able to see which patients are more at risk, more prone of having dry eye disease, for instance, after having surgery. And I think also what patients might have a higher risk of developing a corneal ulcer, for instance, in contact lens wearers.
Okay.
The preventative eye drops, so the prebiotic eye drops, I think that at this moment there is not enough scientific evidence to develop those drops. Yeah.
Okay.
Yeah.
And what are the next steps? What are the aiming of your research? The next steps you are thinking of?
Okay. So we are currently building a normative database. So we're building a database which will give us knowledge on how the normal ocular surface microbiome looks like in males, females, different age groups. And we also look into the effects of seasons. So we follow up patients for longer periods in time, or not patients but healthy volunteers. So we know what the normal microbiome looks like and what the normal variation looks like. And of course, this is extremely important to know what a disease microbiome looks like. So I think this is the first step to further develop.
Oh, very interesting. And congratulations for your research.
We
will change a little bit now. We will talk a little bit about hemoderivates. And I would like to first question is, what is your experience and what kind of hemoderivates do you use usually?
Okay, so in Belgium, it's all autologous serum eye drops at this moment. It's of course, it's a game changer in severe dry eye disease patients, but we're still searching for better options. So this is why we are currently investigating allogenic platelet lysates eye drops. Platelet lysates means that it's coming from the blood platelets, which reside all the growth factors and the cytokines. So the level of growth factors will be much higher if you compare it to serum eye drops. And we also want to go to allogenic variants because we believe that in autologous serum eye drops, there is also a risk that the inflammatory mediators from a patient with a systemic disease are also present in the autologous variants. So this is why we prefer to go to allogenic platelet lysate-derived eye drops in the future. So currently we are investigating in vitro, and in time we will also look in vivo.
So what are the main indications? You talk about dry eye disease, okay, but there are another situation that you consider to use autologous serum eye drops?
So it's especially dry eye disease, but especially in patients with an underlying systemic disorder, such as the ones with Sjögren's syndrome, graft versus host syndrome, lupus, so the ones with an underlying systemic disorder. Yeah.
And when do you decide to go to that kind of therapy? It's in the very beginning, I'm sure not, but when is the point that you decide to move to that kind of therapy? Okay,
so first we want to be sure that it's at least as good as serum eye drops. So this is why we do the in vitro testing. We also need a legal framework. At this stage, there is no good legal framework for the allogenic variants. So once we know it's definitely not inferior and there is good legal framework, normally we will shift. Okay,
very good. Now, two last questions for you. How do you feel when a resident refuses propose from you to do a specific research?
So if I ask them to do a scientific research and they refuse, I first ask to reconsider because it's
It's better to think about
because probably they didn't know that it was a very interesting topic.
Okay, and final question.
Yeah.
It's your daughter's birthday.
Yeah.
You have to go home to prepare the party, and are 7 p.m. and the administrative calls you to see a final patient.
Okay.
And you say, okay, that's one more patient, no problem.
Okay.
And when you start seeing, you see that the patient has acute glaucoma, pupillary block, and so on, so on. What is the first word that comes on your head?
Fuck. I have to call my husband again that I will be late at home.
Okay, sometimes it happens in the reality.
Yeah, it's
not
reality,
like this, but
yeah.
similar to like to
Yeah,
this.
of course,
Yes,
it happens. It happens often.
We are medical doctors, and
yeah,
these things are. This is our real life.
yeah, it is. It happens often, and then you say, "Oh,
Oh
not
my
again."
God.
Yeah.
Okay, thank you very much, Ellie, for the interview.
Thank you for the questions.
And welcome
Yes.
to Portugal.
Thank you.
Now we will move to Dr. Miriam Barbani, okay, and we'll change a little bit the topic. Okay, Dr. Miriam Barbani comes from Spain, from Barcelona, from Barraquer Ophthalmology Center. It's a great pleasure to have you here. And we'll talk about challenging cases of limbal stem cell deficiency and how to deal with it, what kind of surgeries you can do to these patients. And my first question is about the diagnosis. How do you look at these patients? What are the specific details that you look for? And how do you feel the importance of a right diagnosis to then choose the right treatments?
Well, in fact, doing a good diagnosis is crucial for choosing the correct surgical approach. So it's very important to do, first of all, a good clinical history. Ask him about how the disease has started, how long has it been like this, the age, all the historic events, pathologic diseases, and also ocular surgeries are very important. And once we have a suspicion of the possible diagnosis, in some cases we should perform some tests, such as conjunctival biopsies, to be sure or to try to recheck our suspicion.
Yes. And how do you manage these patients regarding the severity of the disease and the underlying condition?
So first of all, it's very important to look at the face, generally to check the blinking patterns, the exposure, the skin, and of course then we go to the ocular surface, checking if we have a good fornices or there's fibrosis that is affecting, and then we check if all the structures that we consider normally are normal or not. So depending on the ocular situation, the anatomy, then you will have to select the final surgery.
Okay, and regarding this point, the final surgery, what kind of surgeries we can offer to these patients, and what is your flow chart that to decide the right surgery for that patient?
First of all, I will try to stabilize and try to enhance the topical medications that are on, and sometimes in some cases we will need to refer the patients to our colleagues, internists or rheumatologists, to check the systemic situation. And once I have controlled this part, then I will go to make the proper choice. Generally speaking, if we have the option that the disease is actually not affecting the vision of the patient, I will try a conservative approach. And if I have a low vision, then depending on if it's a wet, blinking eye or a non-blinking dry eye, then I will switch to different surgical techniques.
Mm-hmm. Regarding the prognosis, we generally feel that these patients have a poor prognosis. Do you have that opinion, or your results are good?
When I started in this field, I was very impressed for the previous the results of many patients that came for a follow-up, and I was really surprised that, for example, patients that had been 15 or 20 years with an osteodontokeratoprosthesis were still having visions of 1.0. So you became a believer in the technique.
Yeah.
And this motivated me to start with these options because it's life-changing.
So this end-line patients, so they have a new hope.
Yes.
With this.
So
this
it's worth a try. Of course, there are some cases that with the pre-surgical study you will feel and know that there's no visual prognosis, so you won't pass a surgery with them. But so many others that have been told that there's no more options, and when you tell them that yes, that we can try and it finally works, it's amazing.
Okay, we are reaching the end of this interview. One question is, if you have a patient, you are doing a DMAC, okay, you are trying to unfold the DMAC roll. It's very difficult to unfold, it's always decentering, then it's upside down, then it's not unfolding again, and you are losing your patience. And who do you blame in these situations?
In this situation, it's very easy to blame another person but you. But I think that the experience is especially important in these cases because you learn with time that the best options is like to relax, breathe, try not to panic because there will be always a solution. So the most important thing is not to panic and not to start like blaming others. Just concentrate on searching a solution.
Stop, breathe. Think and act. Yes, I totally agree. Yes. And now the last question: what would say nowadays Dr. Miriam Barbani to the first day residency Dr. Miriam Barbani?
Well, I think that I could tell her like to do little by little, take a breath, and try to learn things. But still try to keep the human touch.
Okay.
And don't panic, little by little, grow. And enjoy. Enjoy the travel.
Okay.
Yeah.
Thank you. We are now ending these interviews. I would like to thank once again to Dr. Ellen Delbecq and Dr. Miriam Barbani. They are also from EuCornea. Okay. Dr. Ellen Delbecq is from the EuCornea Young Academic, and Dr. Miriam Barbani is from EuCornea Board. So it's a great pleasure to have you here in Portugal and doing this episode of the Falamos GPS. And so now we are ending. E assim terminamos episódio do Falamos GPS. Este e outros episódios estão disponíveis no YouTube, Spotify e Apple Podcasts. Siga-nos, subscreva, faça like, porque com o Falamos GPS ver mais longe é só o começo.